the patient lost teeth number 28, 29, and 30, and I don't have a guide to help me. However, I know these numbers that I just told you about. In this case, I opened flap. Obviously the mesial and the distal implants are the most important because they are next door to roots, to natural roots, and I cannot move those roots. So I would go 2 millimeters plus the radius of the implant. I drill for the first implant. You go a couple of millimeters plus the radius of the distal implant, and you drill for that. And now you look at the X-ray, and you will see. You will also calculate with castrovial caliper, and you would go from the first to the distal hole. And obviously, if that distance around 16 millimeters, if you remember, we said 7 to 8, 8 to 9. So on average, if that distance is 16 millimeters, I can get away with third implant. Otherwise, the patient will be getting an implant supported bridge. So look here. After the mesial and distal implants, I calculated and I figured I can place implant right in between and still ending up with a good 3 millimeter. Took X-ray, continue with the drilling. You can see on the lower left-hand side picture, I have roughly 2 millimeters, and then the red, and then the first osteotomy, and then 3 millimeter, second osteotomy, 3 millimeter, third osteotomy, and then again a couple of millimeters. And you can see here the implants are positioned extremely close to ideal. I mean, looking here, you might say, okay, well, this osteotomy should be half millimeter to the right or so. But bottom line, you can see here the implant positioning is very acceptable. I was able to make decision on should I place 2 or 3 implants, also going out of these numbers that we mentioned. And this way you will not end up with the implants too far or too close or extra, too many implants for that space. So now it's too tight to restore, etc. So knowing these numbers, again, you will end up with very close to ideal positioning without any help that quite often might not be able to have. Between natural teeth, that's very easy because we said we would like to stay 1.5 to 2 millimeter away from natural tooth. So obviously 1.5 millimeter, let's say minimum on each side, plus the diameter of the implant. So what is the minimum distance between 2 teeth I need to place 4 millimeter implant? That would be 1.5 plus 4, the entire diameter, plus 1.5 on the other side. So I would need at least 7 millimeters distance between 2 natural teeth in order for me to place 4 millimeter implant, and for the restoration of that implant to look nice, for the papillae also to look natural and all that stuff. So that's very easy question. Now you can push that and be as close as 1 millimeter to the root next door, but we're talking about ideal positioning, and again 1.5 millimeter on each side of the implant plus its diameter. This is a case where I did not have that minimum. If you can look here, you can, this patient been through ortho already. Tucking him into ortho again is not possible. And we have just under 6. And we are short of millimeter or even more to place the implant. In that case, what you need to do, either ortho or in this case was not possible, then you would have to compromise and gain more distance by using a narrow platform implant. So this is, we will take I would numb the patient, take football-shaped diamond, and as you can see here, literally one pass, and I would create 2 soft tissue papillae. If there is any bone in my way, it will be also removed. And you can see here, within a few seconds, I end up with a scalloped gum with 2 papillae. I end up with more papillae on the distal. That's because how I started. If you look at the first photo on the left-hand side, you can see there is more gum, obviously, on the distal. But nonetheless, here we go. So one drill, 2.0 drill, and you take X-ray, verify that you are right in the middle between, in the. It's not important really to be in the middle between 2 roots. You need to be dead center on the in the clinical edentulous area. So the implant crown or the implant should be dead center between crowns and not roots. because sometimes the roots are tilted and you are closer to one root than another. That is not important. As long as you are not too close to a root, hopefully you have a good full millimeter between the implant and any of the roots. But what you look at is to be in between the two crowns on the top, because that's where the patient is biting.
To watch the remainder of this webinar and for access to all of OsseoNews.com's past and future webinars, please become a premium member of OsseoNews.com. To become a premium member, simply click on the Premium Membership tab to sign up now and gain access to all of OsseoNews.com's past and future webinars.